was for my daughter, who's 13, and she had gone to her pediatrician with several different outbreaks, rashes, different things, and they did a blood test and discovered positive for ANA, which is anti-nuclear antibodies, and the pediatrician suggested it may be lupus. So that was a huge panic, and so she sent us to a specialist. I came to Pamela between that appointment and the specialist appointment. She was talking to me. I had actually gone to her with an asthma question. My daughter also had asthma in the midst of all of this. I really didn't know much about it, so I thought possibly it would help her with episodes of lupus. I was sure that's what she had. Possibly Pamela could help us lessen the duration of an episode, or show us how to eat healthier. I just didn't know. First off, she hasn't had any asthma, and that was the secondary reason that we came, but she hasn't had any. Since she was having maybe 3 or 4 episodes a week, and it was things like mold. Different seasons would cause it. The doctor did say mold was an allergy for her, dust particles, things like that. So I didn't think you could get rid of that. They wanted her to take medication, several steroids, and I didn't want her to take all of that. I did give her some. For over a year, we did several different kinds of steroids. She's not on any asthma medication. She hasn't had any episodes of asthma at all. As far as the lupus, we did go to the specialist, and she did not have anything. He said there is absolutely no signs of anything. The tests that the pediatrician had done were in front of him, and he said, I don't see this now. She had it, but I'm not seeing it now. So that was huge. I was skeptical because we were doing lots of testing with her pediatrician and then with the specialist, and this was so simple and non-invasive, and I just thought, how could this really help? I would tell a friend that it wouldn't hurt to try it. Because of all the medical testing Aubrey was going through, I came here and I thought, it isn't hurting her. It's non-invasive. It's very simple. But I would tell a friend that it does work. It does work. It did work in Aubrey's case, and we've seen huge results with it. Pamela conducts herself very professionally. I was very skeptical, and she took the time, almost an hour and a half, to talk with me, reassure me, answer any questions, pose questions to me that I hadn't even thought of. And I was very calm and reassured before she started.